the strategy that we usually take on my team is to just have the UFMEA, which contains all of the information the FDA is asking for, right? It might not be the exact same categories worded in the exact same way. And then the way that we do things is we make it really clear to the FDA in the summary report when we're submitting it, right? So there are several sections about risk. And in those sections, we don't, we just focus on the critical tasks and these associated pieces of information so they can look at that rather than, the entire UFMEA. I have heard that others have had issues with sending that whole UFMEA and the FDA sort of asking for something more similar, but I've found it to be effective to use just one document, but to provide the FDA the information that they're looking for in those summary report sections and not everything that's in the UFMEA.
My only caution with that is to make sure that all of the consumers of that UFMEA are getting what they need out of it. So if risk is pulling it out or engineering is pulling out information from the FMEA and they don't want anything in it that's more than a single fault failure, then it might not serve your needs from a human factors perspective, right? So make sure that what you're capturing and the way you're capturing information in that document is serving the needs of human factors, of risk, of engineering. And if you can identify a way to do so, and I've seen really good ones, then yeah, it would be great to do that all in one place because you're thinking about it in one place. But if that can't be kind of breached, sometimes it's looking at potentially separate tools to inform, but you need to then keep them in sync. So that is a challenge.